Okay, we're live. So can you tell everyone who you are, please?
Okay, I'm Dr. George Isajiw. I'm a board-certified internist in private practice in Lansdowne, Pennsylvania, where I've been for the past over 40 years.
Yeah, talk to us. What have you seen? What have you experienced? What did you make of this COVID thing?
Okay, well, I was fortunate enough, in a sense, fortunate enough, early in the mid 2020, that I became suspicious of what's going on with this vaccine world, as they were advertising. Wasn't out on the market yet, but there was a priest, a Ukrainian Catholic priest, Father John Fields, because this made national news, who had volunteered for the trials, and it was all written up about how he was going to help humanity and willing to take risks and so forth. And shortly, a couple months later, he was found dead in bed in the morning without even, trying to get out. So it was obviously a cardiac death. And what caught my attention was the fact that 24 hours later, Pfizer said, "Oh, this could not possibly have anything to do with the vaccine." And I figured, well, any self-respecting physician who would be running a trial would say, we'll have to look into it. We have to investigate it. Categorically to say it had nothing to do with it. I said, well, maybe they meant that because he was maybe in the placebo group. Well, if he was in the placebo group, they should have immediately announced that he was in the placebo group. But they didn't say that. They just said it had nothing to do with the vaccine. So that got me a little suspicious. So anyhow, in January of 2021, I had one lady in her 70s who, 2 days after receiving the Pfizer vaccine, had a cardiac arrest and died. And had no previous heart disease, absolutely no reason to have that happen in terms of her medical history. And actually at that time I got COVID myself. It was a very mild case because I was taking hydroxychloroquine prophylactically ever since day one back in February of 2020. So I tested myself. I had natural immunity and so forth because I thought that maybe it was a false positive, because 30% of all those PCR tests at that time were turning out to be false positives. But no, I really had it, and I had natural immunity, and it persisted. Well, several weeks later, I got a patient admitted to the hospital, 62-year-old African-American male who, in excellent health, never had a problem, massive bilateral pulmonary emboli. And he had taken the Pfizer shot approximately 10 days prior to that. So obviously, I don't know how long it took the clots to form, but that was when they got into his lungs, and he came in short of breath. Fortunately, we were able to save his life, but he's now on blood thinners for the rest of his life, because nobody dares to take him off the blood thinners, not knowing exactly how that came about. I have no doubt it had to do with the vaccine. There was another patient, again in those early days, that had a stroke 1 day after getting the vaccine. Now, this is a lady who had a previous stroke, had recovered from it, and then 24 hours after getting, again, it was the Pfizer shot, she had another stroke. Fortunately, again, it didn't. She was able to recover, not to the degree that she did before, but she's still alive and well with us. So that caught my attention, and I was paying attention. And we've had people with unusual eczemas that never existed before in their lives. It started happening within a month or so after these shots. I know of one young woman who was 28, developed Raynaud's phenomenon, Raynaud's syndrome, with the fingers getting white and ischemic, and then I've heard of a friend of a neighbor of one of our patients, a 6-year-old boy, had died from having the shot. So
6-year-old boy.
6-year-old boy, yes. It was in Philadelphia, and that was actually on the news and so forth. But of interesting, I think, as a sort of an aside, his father was a doctor, or still is, of course, there, and he made the statement. He had such faith in the vaccine, and even though he himself admitted that it might be a vaccine, but he said that's not sometimes you have to make sacrifices for the sake of the rest of humanity. So he wasn't even upset that his own 6-year-old son. And there was no reason to give this vaccine to children. I mean, the risk of any child, even if they got COVID, and very few of them got COVID, or got clinically significant enough COVID to make the diagnosis. So that's where we're at. I'm a member of the American Association of Physicians and Surgeons. We had Dr. Peter McCullough, who was a member of ours, investigate this early in the game. Of course, he's a cardiology virologist. So I began to learn from him. I learned how to treat people with ivermectin, hydroxychloroquine. Hundreds of people. A lot of them were not my patients, but my patients would call me. They're sick with COVID. I put them on the treatment. They get better. And next call would be from you treated my cousin, so would you treat me? Because my doctor won't even talk to me. He said go to the hospital and so forth. So this is basically the story that I can give you. And the more I learn about these complications, and thank God for Children's Health Defense for giving all the news that I can follow now, and of course the Vaccine Safety Research Foundation with Steve Kirsch and so forth. I've gone to the meetings and learned a lot of things. So now I tell all my patients absolutely avoid the COVID shot. I am very, very concerned now that since we now know that the spike protein stays in the body for who knows how long, certainly up to 3 years that's been studied, that anything that excites the immune system can exacerbate some of these antibodies and cause an autoimmune reaction, even though they had the shot 2 years ago. So I question whether somebody who gets a flu shot and gets a reaction, whether that's really a reaction to the flu shot or it's sort of a memory exacerbation of the COVID antibodies and the spike protein, because spike protein, being an artificial protein never seen in nature, the body doesn't know how to get rid of it. And that mRNA just kept producing so much of it that it was even within hours, much more than was ever needed to cause an immune reaction like any other vaccine would be. So
we hear a lot about the mRNA shots, but we don't hear very much about Johnson & Johnson or the AstraZeneca, obviously, because it's not in this country. But we still hear, we do hear about injuries. Yeah. But we don't hear people like you talking about them. Is there a particular reason? I know the mRNA, but we're still seeing blood clots and heart attacks in Johnson & Johnson.
Well, I'll tell you the reason. Part of the reason, there may be other reasons, but I know my friend physicians who are employees of hospitals and big systems. They said, yeah, we've seen it, especially emergency room physicians, but I don't dare talk about it because they'll fire me. You had this, I wouldn't call it a real conspiracy. I don't think it was done, proactively, but these people were so afraid of being, persecuted by the government or being persecuted by the medical board or whoever, that they, and also every one of these big institutions relies on funds from the government, research fund from NIH, and they all decided to cover all this up. So I say, fortunately, through the American Association of Physicians and Surgeons, I was fortunate enough to learn this early in the game.
Now, we've had a lot of reports on the road where people who did not take the COVID shot saying they feel very unwell when they're around people that did. So my question is there something in that or not?
Yes, well, I'm no expert on it, but from what I have heard from lectures from people who have studied it, there's no doubt that at least for some period of time, the spike protein that's so overproduced by the mRNA comes out in sweat, comes out you can breathe it out, you can sweat it out, and so I have no doubt that it may contaminate other people, especially those who are close. I think early in the game there was some research done on women who were like in prisons or in dormitories who had menstrual problems as a result of the shots. Of course, Dr. Jim Thorpe, who was an obstetrician who studied even and saw the increase in miscarriages and saw the increase in infertility and so forth. said that this couldn't statistically be just sort of an emotional reaction, that the women who didn't get the shot but who lived in the same dorm or lived close proximity would get menstrual distress also, even if only one of them got the shot. So there's some form of transmission of that. But I'm not going to say definitively because it's not within expertise, whereas the clinical part is, I've learned it well, and I can say that with certainty. Yeah.
So going forward this winter, we're expecting some kind of fun and games. Now, one of the things that we've been hearing on the road so far is the unvaccinated being sort of targeted, as they report when they go into hospital, get put on remdesivir, prevent death.
Yeah.
How do we protect ourselves this winter, in your opinion? And this is not giving out medical advice. Just say, I don't know, you're talking to your daughter or something. What would you recommend them have in their house so that we don't have to get to the stage? Seems to be a lot of people were panicking with that thing on their finger when oxygen went below 90 or whatever, and everyone freaking out and going to hospital, and they're not coming out.
Yeah. Well, first of all, I'm glad you brought up remdesivir. Horrible drug. I mean, unfortunately, I used it in the beginning because I didn't know any better, and that was with the accepted drug. But it was in November of 2020, the World Health Association actually put out a warning saying that the remdesivir was dangerous for liver disease and kidney shutdown. And I've seen one kidney shut down with remdesivir, and in the U.S. somehow that was ignored. So I think that's a medical legal issue. I know there are law firms who have litigated as to why hospitals continued to give remdesivir when after in 2021 and even in 2022. So that there's clearly big danger, and it didn't do that much to change the outcome of the disease, and I think that's well known now, but again, not admitted by the powers to be. Yes, to answer your question, I'm no expert on those particular things, but I've seen it. A friend of mine, a physician who had all the shots early because he was a employed physician. He had to. He got COVID a second time, and as a result of remdesivir, he went into kidney failure, and then wound up on the ventilator, and wound up dying from complications of that. They did not recover, and then you hear other stories like that. But this is stories of people who I've been intimately know and in touch with. Going back to the vaccine, I know one of my nephews, his wife's niece, 18-year-old, who was forced to get the shot because she was a big athlete and she couldn't perform. She couldn't be in the team, whatever team that was, and got neurologic damage and can never play sports again. So they're galore. They're all out there. A lot of people don't even know they're vaccine injured because they go to their doctors and they give them a different diagnosis, and it's sort of a matter of faith. Doctor, it can't possibly be happening, because if it was real, we'd be hearing it from the government or we'd be hearing it from the FDA, and that's not happening.
It's a shock for so many people waking up to the dangers of the informed consent that we should have been given. I mean, this is a memorial in here. Everybody in here is dead.
Right. But to answer the further question, well, I took hydroxychloroquine daily. 200 milligrams once a day. It's a very safe drug because I've given it out in rheumatoid arthritis and various arthritis for 40 years, and never had an adverse event, never had a cardiac event from any patient. And as a result, when I got COVID, I hardly knew I was sick. If the test wasn't positive, I would have not even thought it was COVID. So that's one thing that you can do. Vitamin D3 is very, very important. I'd say at least 5,000 units. Some doctors are saying 10,000 and more. Again, I'm not an expert, but I tell all my patients to take 5,000 units. There's been very good studies that showed that people who were hospitalized and died, on the average, had lower vitamin D levels than people who recovered even without any treatment, had high vitamin D levels. And it does slow down the entry of the virus into cells and gives your immune system time to fight off the virus. And it was always also, I think, explains to some degree why African American people or people with dark skin seem to get more seemed to get sicker from the COVID virus, and because their vitamin D levels weren't as good, given living in a northern climate, they weren't. Their skin protects them from the sun, and you need a lot of sun to generate vitamin D. So I would say, as a minimum, vitamin D3, 5,000 units. I advise that to all my patients. Now, if they want to take vitamin C, 500 units. They want to take zinc. That's all good. And anytime I treated COVID after it was diagnosed, I would always have a vitamin D, higher doses, vitamin C for a while, zinc, and there's a number of other natural elements that can be used. As a matter of fact, there's so many that's been tried now and are shown that I've never been trained in that. That's why I want to go to Savannah next next month. I am coming. Yes,
Lovely.
yes. So I want to train more in that. But you have organizations like flccc.net, Frontline Critical COVID Care. I've listened to them. I've been to their meetings. Absolutely wonderful stuff. I'd recommend all their protocols. Believe me, they work. I've used them for the past 2.5 years.
And you'll meet Dr. Suzanne Humphreys.
Pardon me?
You'll meet Dr. Suzanne.
Oh,
Humphreys.
okay. Yeah,
She's
yeah.
going to be there as well.
Yeah, okay.
So, well, look, thank you so much for sitting there and talking to us about your experience. Is there anything else you want to say before we go?
Well, all I do is emphasize that I'm willing to take any patient, and after advising them not to take any more COVID boosters, if they are being forced to, I'd be glad to give them a letter of exemption. So I'm not saying that you should call me, because I don't think I give everybody a letter of exemption who hears this interview. But there must be somebody out there that through these various hotlines that they can call for help. So I'm sure you're aware of what they are. We do also know for sure, and I've seen that people who had COVID had natural immunity and then got boosters or got their first shot after that actually did worse when they got COVID the second time. And Dr. Fauci said, if you have natural immunity, still take the shot because it's additive. And I've learned from experience, it's not additive. What happens is the mRNA, the vaccine antibodies seem to take preference to attach themselves to the virus, and then your natural antibodies, which are better at killing the virus, are blocked from attacking the virus. So actually you get lower immunity as a result of that situation. And so therefore, absolutely, if you've already had COVID and you have natural immunity, taking a shot after that actually makes things worse, no doubt about it, even if you don't get a shot reaction.
That's great advice. Thank you very much.
You're welcome.
Thank you for being so brave and sitting there as well and talking to us.
I appreciate you.
How can people follow you? Have you got a website or something?
No, I actually don't.